Hey guys, Adam and Dakota here to talk to you about PNF, which is proprioceptive neuromuscular facilitation. It's a pattern of diagonal and spiral motion utilizing a combination of motion in 3 planes of movement. For D2 flexion, it involves shoulder flexion, abduction, external rotation, shoulder extension, forearm supination, wrist and finger extension. It's absolutely crucial when performing PNF properly to make sure you're moving the segment distally prior to moving proximally. And for the purpose of this demonstration, we're going to have the patient holding a baseball to properly prepare them for the return to activity that our patient would be seeing.
We're going to start with passive PNF pattern to teach the patient how to utilize this pattern. This is the first stage where we're going to use in early stages just to teach. So we're going to start with the patient internally rotated and adducted at the shoulder. The elbow is going to be slightly flexed, and the wrist and fingers are both flexed. To start the motion, the patient extends the wrist, supinates the forearm, extends the elbow, and then flexes, externally rotates, and abducts the shoulder. To return, we start distally. We're going to flex the wrist and fingers. We're going to pronate the forearm, start bending the elbow. Then we're going to internally rotate and immediately adduct the shoulder. And that is the D2 PNF pattern.
Hey guys, so now that he's got the hang of it and he's going through it passively just fine, we're going to see if he can handle it actively, get a sense for what he's going through. If you want to go through the motion, Dakota. See how he starts distally and works his way proximally? That's the key to good PNF. Good job. So now that the patient is actively going through the PNF pattern we're striving for, it's about time to incorporate slow reversal holds, which is essentially an isometric contraction at the extremes of the range of motion or at any point along the motion that the patient's having particular weakness. So now that the patient is actively moving through the range of motion that we're wishing for the PNF pattern, it's time to institute slow reversal holds, which is essentially an isometric contraction at the extremes of range of motion, or you can also incorporate it anywhere the patient's having weakness along the pattern of movement. Let me demonstrate for you. Now it's important to remember that in the middle of the range of motion is usually when patients are the strongest, so grade your resistance accordingly.
So another thing that we can incorporate is rhythmic stabilization. Adam, will you go ahead and go through the range of motion? Okay. So first, one of the great things about PNF is I can apply resistance throughout the whole thing, or throughout the whole range. So go ahead. Okay, then come back. Then I can tell him to stop. Adam, stop. And then early on in the rehab phase, we're going to be working on down here. We don't want to put a lot of tension. But as we progress, as the tissue gets stronger, we can move up the chain, which makes it harder for him. It puts appropriate tension on the UCL. And we can also work throughout the whole range and have him try to hold still and try to knock him off. This will provide proprioception to not only the shoulder, but also the elbow. So we're really working on the whole limb here and not just focusing on the elbow. So you've seen a variety of different techniques that you can use with the D2 PNF pattern. Some benefits are we can use it early in the rehabilitation process or even late in the rehabilitation process. You can use light or maximum resistance. You can do it at the extremes or you can do it throughout the range of motion. PNF also uses a combination of the movement patterns among all the joints, and it's extremely functional for pitchers, especially this D2 pattern. We'll see you on the field, Slugger.